My name is Sherry Dargan. I'm the president of the League of Women Voters of BlackHawk-Bremer counties. Welcome to our YouTube channel. I want to thank everyone who helped us with the forums. And I hope you folks will follow us on Facebook or check us out on the web. Our website is www.lwvbhb.org. Now, let's get to the forum.
Okay. Hi there, everybody. If everybody could just sort of get seated, we're going to get started. Make good use of this lunch hour for those who have to get back. Hi, my name is Steve Kerrigan, and I'd like to take a moment and have you all look around, because this will be the first time I've been able to actually facilitate a forum in person for the League of Women Voters. And having been Zooming for a while, it does feel a little weird, I have to admit it. But at the same time, take a look around and recognize that we get to share our thoughts and understand each other a little more clearly when we get to be in person. And so that's a blessing, and we should all be glad of it. And so appreciate that today, and appreciate seeing all the friends that you haven't seen for a while, and appreciate our panels being willing to come together. First off, thanks to the League of Women Voters of BlackHawk and Bremer counties, the BlackHawk-Grundy Mental Health Center, Hawkeye Community College that sponsored today's event. And a reminder that this is going to be streamed live on the League of Women Voters Facebook page. So welcome to all the folks who are hopefully catching it now, catching it live, or maybe catching it later as a recording. Brief introductions of our panelists. Jennifer Schneiderman, a director of the UNI Counseling Center, wave so they know which one's you. Deanna Schaefer, mental health therapist from Hawkeye Community College. Heidi Warrington, chair of the Black Hawk County Veteran Commission. Alyssa Fruitnicht.
You got it.
LISW, member of Behavioral Health Services at BlackHawk County Mental Health Center. She replaced Tom.
Yeah, I will do my best.
I got a Fruitnicht instead of a Tom. And then, of course, a nurse as well as a representative from the state legislature, Timmy Brown Powers. So our hope is we have a few prepared questions. We'll go through them, sort of pass them down along the panel. And then we'll open the floor up for your questions at the end, okay? Nod, okay. Not online. So our first question panel is, has COVID increased the demand for mental health services? If so, which we suspect, what are you seeing? Anxiety, stress, addiction, suicidal thoughts or attempts? And Timmy, if it's all right, could you start off on this?
Sure. Sorry, I got to remember that, Mike. So as we have talked to folks in the legislature and then come home and visited with folks, I think all of the state legislators are very much aware that that's made a huge effect. One of the things that Bob and I, we had different meetings this week, but Representative Kressig was on a meeting just yesterday, and I was on one 2 days ago, but the school counselors are really reaching out and concerned. Right. So these kiddos were home for a long period of time with no one really overreaching with them. And now they're back to school, and we've got them kind of all over the place. And as far as emotional and those things going on. So that's been kind of the big focus for us down there. And secondary, I think all of us at some point during this COVID time had some feeling of doing meetings through little squares on computers, not having that social interaction. And we know our seniors were isolated. My program in my real other job is my folks couldn't come to therapy. So I was reaching out to them at home. And so a lot of people just felt that isolation. And then to come forward for that, a lot of them still are just now coming out or reaching out to me because they were kind of scared, and they've got depressed when they were home, and they weren't really sure how to get back out into the community and how to get involved. So COVID, at the beginning of COVID, when we were down to legislature, I thought, maybe this will make us more kind, and maybe this will bring us together, and maybe we'll reach out to our neighbors and we will be more aware, right? That was my initial hope. And I had said that to me, maybe this is just our way of saying, get your act together. We didn't. I mean, I think a group of us did.
Some of us did.
Some, you know, we tried to, but overall we didn't. And we had, you know, kids at home, elderly at home, friends at home, and we didn't come out more kind. In fact, I've been at some settings that seem more toxic than they were even before. So I think we have a long ways to go. I'll speak more about the state legislature and what we're not doing to help that as we go on today.
And so I should set the expectations for the panel. It turns out we're not going to make all of you answer every question unless you'd like to. So if someone uses most of what your answer would be or something like that, just say, I'll pass on this one and we'll move on. And that way we'll get more questions. Okay? So feel free, Deanna, to set the pace.
I'm going to take the mic for myself.
All right.
As the mental health therapist at Hawkeye, I actually started the year, the fall before the pandemic. And so I've been able to kind of see what that experience has been like the year of the pandemic. So, you know, switching everything to virtual and online, having classes go online really without much prior notice, and what that did to the students. And then the year after, and even still now. So at first, I was noticing a lot of anxiety, depression, isolation, things like that. But actually, as we come out of it, I've been noticing students with increased social anxiety, because what happens when we have a bit of social anxiety to begin with, and then we don't have to face our trigger or our fears for a couple of years and come back out of it. Well, it turns out our skills get a little rusty and that anxiety gets higher. Another thing that I'm hearing now, I'm working now with of the traditional students that I work with, students who are juniors in high school when this happened. And a lot of them who didn't have the, you know, social supports and other sort of steadfast parts of their life outside of school ended up being home and really losing a lot of those natural supports that they would get in the school place with things that they were involved in, and really struggling to kind of readjust now. When they're not connected with those same things, they've switched from high school to college, but didn't have that sort of natural transition and handoff. Just for me, since I am the only one at Hawkeye, between 2019, 2020 and 21, 22, those academic years, I myself have completed more than 150 more sessions in not even a full academic year than I did 2 years ago, and I've seen an increase of more than 40 students than what I saw last time. So it's just been a steady increase and doesn't seem to be slowing down anytime soon. So those are the main things that I've seen.
Just to stay on the college population topic, at UNI, we're seeing very similar things as far as the explosion of mental health concerns and needs. I would say, though, too, that COVID and the pandemic seemed to be an accelerant on a fire that had started even prior to the pandemic, as far as the social landscape changing and our students' ability to interact socially, which creates a lot of anxiety for college-age students now that we are back doing more things in person again. So I think, you know, when a lot of these students had phones in the 5th grade and Snapchat and social media and some of those things, their ability to interact and communicate has been changed by that. And then we throw them in a situation where they can't interact in person and with nothing but their phones. And I think that was kind of an accelerant on a fire that was burning. We know that prior to the pandemic, suicide was the #2 cause of death for college-age students. And that continues to be, of course, a great concern. So we continually are doing efforts at UNI to kind of monitor and manage, keeping an eye on each other. And you don't have to be a mental health professional to do that. So it's really trying to educate our whole campus as far as how to support and help each other and look for things, keep our eyes open, be aware, and bring out that kindness that we were hoping would come from all of this by really reinforcing those messages now. Lisa, go ahead.
I will take it a little bit. So at BlackHawk-Bremer Mental Health Center, we have about 11 school-based mental health therapists that serve the Waterloo and Cedar Falls Community School District. So I will kind of switch a little bit to that kid and adolescent view and what we've been seeing during the pandemic and since the pandemic on that team. And so really in going into this current school year, we hired 4 additional school-based therapists to join that team. And as we continue to grow as a program, we continue to serve more students. Last school year, so if we look at last year, we served 700 students between the 2 districts. So far in 2022, we're up to 640. And so we will outpace that 700 before this year is over. And so we've really seen as we've grown that program has grown. We worked actively during the pandemic to reach out to families, to do virtual care, to be able to still build those connections. And we, like Deanna mentioned in the college students, having students that maybe had some anxiety and some worries and some depression prior, and this kind of escalating and elevating those concerns, and then the return to the classroom being tricky and adding complications to what they were experiencing, and really making sure that we can wrap around those supports. But our program continues to grow, and we continue to get referrals after referrals for students who have significant needs. The U.S. Surgeon General recently issued this is a crisis in our country regarding the mental health needs of our kids and adolescents. And it's something that we need to pay strong attention to because the needs are great. Yeah.
And I'm going to just quickly address the veterans population in our counties. And start out with, remember that if you're downrange, you always come home with some moral injury. It's impossible not to. It's the aftermath of war and the nature of it. So then when you layer that with what's been going on with COVID and the pandemic, the access to mental health services has been poor, to say it at best, because we're so under-resourced. But in our veteran community here, one of the changes that we have seen was more isolation. And the only way we could kind of crack through that is the human to human touch, a veteran to a veteran. Because with the isolation that the pandemic and COVID imposed on offices being closed and all of those issues, we needed to kind of mobilize with our own population, our veterans, and say, you've got to be that link, because the physical coming in the door was shut for a while. But for anyone that doesn't know, we did achieve improving our real estate. And now we actually have room for a visiting psychiatrist and mental health worker to come and see our veterans. It's still in the works. It's a partnership through the Cedar Rapids CBOC, because we don't have a mental health worker here that can come over. But we've now got a room appropriate for that. And Elevate opened in the last, I don't know if it's quite 2 years or a year and a half, here in Waterloo. And that provides mental health resources for veterans. And they're about to get a new piece of real estate and expand hugely. Right now they're downtown Waterloo. So our issues with our veterans are similar, but they have some layers that are a little bit different. If you've ever served in the military, it is really hard to ask for help. You are brainwashed into a culture where you take care of the team. And in any form of leadership, you kind of put your needs second to taking care of your team. Once you're out of that and you're isolated, that just becomes an additional challenge. You're more willing to help your buddy than to help yourself, whether it's just a byproduct, of military service. So that's my comments for the first question.
Heidi actually gave us the perfect segue to our next question. So Heidi, I'm going to ask you to answer the second part of this question, as well as the first part that I'm going to ask everyone to answer. And that is, what community resources do we have and what more do we need? And we're going to start on the far end and work our way back this time.
So we're actively engaged. The BlackHawk County and every county in Iowa has a veterans administration. I'm not talking about the hospital part. That's a separate lane. But the Veterans Administration, in every county, there's an office where in order to receive medical services, you first have to have your paperwork processed, okay? And that's the job of the Veterans Administration. That's Yolanda Lovelace and his staff. Every county has them. Some counties, though, are not particularly well resourced. And so do we see veterans outside of our own county? Absolutely. We don't receive benefit for helping them, but that's part of the deal, that we help them. So the resources we have, we recently opened our new real estate, and we have now many offices and community spaces that are used. We have a food pantry that any veteran can walk in. They don't need a voucher. They don't need to tell us how poor they are or how poor they aren't. They come in and walk out with that, whatever they need in our pantry, and it's all donations. It's all volunteer. We also have a lot of engagement events every Thursday. Right now, we have a lunch free of charge for veterans and any of their families that choose to come. It's all through donations. But the important thing is, as our government changes the law, and they recently opened up a lot more medical conditions, including a list of presumptive ones, not only from Vietnam, but from the Gulf War. And so instead of going through this long detailed of going through medical diagnosis and everything when you first get out, now if any doctor has given you one of these presumptive conditions, you come in and our staff will do the paperwork and you will get compensation. In order to be seen in the VA, there's certain criteria in the healthcare world that have to be met. But it all starts with that paperwork being processed. And for a lot of our veterans, when they get out, they're done. You know, they quit their job or they've retired, whatever. And they don't really understand the importance of getting into the system. Once you're in, it's easy for us to reach out to them. So one of my pleas to all of you is, if you know any veterans that are struggling, regardless, whether it's physical, mental, emotional, whatever, have them come in and see Yolanda Lovelace and the staff to see if we can get them the services they need. Many of our services are actually contracted out because we're not where there's an active duty military base. And so we have civilian providers here in the community, but to get that paid for, it has to first, they've got to first be approved. So hopefully that answered, and I'm going to pass it on.
Well, first I'll speak to the UNI community and then to the community as a whole. But we do have the good fortune at UNI of having a training program at our counseling center. And so in our training program, for example, we had 5 interns this last year who we were able to train, who have now gotten positions out in the community. And so we know we are in desperate need of more mental health providers in our community. And I'm very happy that UNI can be a part of producing those mental health providers for the community. We also have a mental health case manager in our clinic that can help coordinate services to the community. So for example, if a student's needs maybe cannot be met at our counseling center or with our university resources, our case manager can help connect them to community resources, and we have a lot of collaborations and partnerships with community resources, thankfully, as well. So
I will talk a little bit about BlackHawk-Bremer Mental Health Center's kind of our services that we offer and then kind of the partnerships we have in the community. So as a community mental health center, we really work to wrap around care around the patients that are served here at the mental health center. We have psychiatry services, so medication prescribers. We have outpatient mental health therapy. We have school-based therapy. We have Deanna out at Hawkeye. We have a provider that goes out to the Waterloo Women's Center for Change. We have a staff down at the Department of Corrections. We have an outreach program that goes into homes to help provide assistance with medications and coping skills. We've got an integrated health home program that helps bridge gaps in care, find resources, help patients get connected to those resources. We recently received a grant that helps us to more systematically screen patients for their social determinants of health. And we know research tells us that the more social determinants of health that someone has, we see poorer outcomes in their adherence to care and their ability to follow through with care consistently. So we're working to actively screen what are those barriers that maybe make it hard for a patient to get connected and stay connected to care. And how do we be a part of addressing that problem at the onset of services? And so we've got a grant that's targeting doing that with our patients and getting them directly connected. They can enroll in that program, can have assistance utilizing the food bank, knowing Love Inc. exists, knowing Your Life Iowa is a resource to call when you're in crisis, Elevate services, right? We really work to connect them to other community partners. We have a homeless program that helps individuals who are struggling with housing to find stable housing. That's a social determinant of health that makes it harder and less likely to be able to connect to services. And so we offer robust programs, not only therapy and medication management, but we really try to wrap around those needs so that we can see positive outcomes in that care that we provide as a whole entity. And being a part of a larger Unity Point system, we are able to care coordinate with Unity Point's new walk-in clinic for adults, with the emergency room, with Covenant's emergency room. We build these community partnerships so that we know our patients are also accessing care in other places. And so how can we all communicate when necessary and when appropriate to be able to effectively provide that care? So we collaborate with other entities, Love Inc., Elevate, Catholic Charities, all these kind of community entities that helps us to meet the needs of our patients. And we're really proud of those partnerships and how we work and strive to collaborate.
At Hawkeye, we do have a care coordinator who was hired within the last year and a half. Her name's Sarah Kinkle. Some of you probably have interacted with her. She moved to the community about a year and a half ago and just hit the ground running and has really connected students with resources from all throughout the community. So that has been really wonderful. We also have a veterans coordinator, Jeremy, and he's also been great. You know Jeremy, don't you?
I do. He's one of our commissioners.
And so those have been really good within Hawkeye. I wanted to just briefly talk a little more in detail about two services that I recommend students use the most, particularly when we're outside of business hours. So the mental health walk-in clinic at Allen Hospital, that's open Monday through Friday, 9 to 4:30. They have a mental health therapist, prescriber right there. And that is no wait time whatsoever. So if somebody needs to be seen and it's within those hours, they're able to be seen there. And I've had students go when they really needed to and have had great experiences there. That's at Allen Hospital, entrance 6B. And then within Elevate, so if you text or call Your Life Iowa, and if you Google that, you can find it. If people need mobile crisis, they're available 24/7. They dispatch Elevate within our community. And so if you have somebody that, boy, they really could use someone to call and maybe even someone to help talk them through whether they need to go to the hospital or not, that has been a really, really helpful resource.
Could you just talk a little bit about Elevate? Because I think we've been using the word, maybe not with having fully explained it yet.
Sure. Anybody want to say it?
Elevate is like a year and a half, 2 years, it's been around in our community. So it's a certified community behavioral health clinic. And so they came to our area to provide additional services, crisis services, services to veterans, peer support services, therapy, medication management, substance use. They're currently located downtown Waterloo. They're getting a new location, and I think we'll be moving at some point this summer, is my understanding. And so they are kind of a newer community entity, a new community provider to our area, but have offered those additional services.
Just to add to that, Bob Lincoln is the director there, and he was the director of the mental health when we were of this Northeast Iowa. That's where he left that position to take over Elevate. So he is very well informed gentleman and had some good connections throughout the community and the Northeast Iowa to kind of help get that program off the ground and started. But been working with him, and I shared with Steve before we started, been working with Bob this week because for the crisis center, the legislature wrote in there that they would have a nurse on 24/7. So The problem there is, you all know, right? We don't have enough nurses to have a nurse there 24/7. As Bob and I were talking the other day, a gentleman was coming in who needed services, and he said, and here's a prime example. So, we are working with Director Garcia and her staff to see if we can change or add into rules, hopefully not legislation, since we're still in session and we've been doing nothing for a month, to help that problem, because all of our crisis centers are going to have that problem. They're going to run into that problem all across Iowa. Bob was just the first one to bring it up, but it's going to be a problem all across Iowa. So we're working with him this week and next. He's going to do a kind of a presentation. He has the staff there. They do have a nurse that can come in and do the initial consults and those kinds of things, but we aren't staffed to have people there 24/7. We don't have nurses at the hospitals at this point, enough nurses. So that's one of the big problems. And along with that, all the great programs that we have, the number one issue when I go to all of these programs, pathways and everywhere, is staffing. There are job openings in every single agency. You guys probably all have staff openings. I mean, it is probably one of our biggest issues going forward for our mental health. So we have that. The legislature, we had the HHS budget, which we passed through the House back on April 20th. It had some good things moving forward. They were baby steps. Don't get me wrong. It was nothing great and grand, right? But they were some baby steps as far as some tuition reimbursement to get psychologists here. There were some things so that people, when they're doing their field work, they could actually practice under the guidance of Deanna and Alyssa. They could do that. So there were baby steps moving forward. If you remember, the state decided, my legislators' friends on the other side of the aisle, to take away the backfill money from the counties. So the counties used to help fund mental health services based in regions, based on what the need was. And we took that power away from the county. So they no longer have that. The state took it. So now the state is in charge of funding mental health services. So being in business with the state historically has not been a great deal because backfill wasn't supposed to go away. That came away from the cities and the counties. Our county supervisors were a little more forthcoming, kind of figured that we wouldn't hold true to our commitment from the state side. So they did not budget that money. They were using other monies. And so as this has hit them, they were able to plan around that. But many counties had that as part of their budget. It was a line item in their budget. So this has created a huge hardship. Representative Kressig serves on a board and I serve on the Child Mental Health Board. And one of the biggest complaints is funding. So 3 years ago, I worked on the Child Mental Health bill that moved forward, which was a great structural bill to bring mental health services to our children. It hasn't done anything for our children since we put it in place because we've not funded it. So there's the problem that lays. And so as we looked at the budget this year, Representative Fry did put a little seed money in there, probably to shut me up, but a little bit there. But the Senate is working on HHS budget. I was down there yesterday to see if I could see what they were thinking. Our Senator Chapman wasn't willing to share it with me. He's not talking to Representative Fry. The HHS budget is not agreed on. So we have no idea where this budget's going to go. And if any of the small things we put in the HH budget for mental health and from the House, if that is even going to exist anymore. So there's just a lot of frustrations out there, between staffing and funding and then your families. So Representative Kressig and I talk to the families on a weekly basis. This is something that moms and dads and grandparents reach out to us because we are still sending our children to Illinois and Nebraska. And so there's no beds for them. So
the number one, what's the number one treatment plan? If I have a child in crisis, do they need their families around, or is it okay to send them out of state? You guys, I mean, because these guys know better than I, but to me, we're sending the number, we're separating these families. And so there's the treatment plan gone to all the, so that's the frustration part. And I feel like we just are scratching the surface. Thank God for all of these people at this table that are doing a great job with very little. Let's remember, very little. She's one at Hawkeye Community. That's all. I met a PA in Dysart. She's one. She's doing everything. She's stitching them up, and she's dealing with mental health issues. So thank God for all of you, but we really are not getting what we need to get done, and we really aren't helping as many people as we need to be helping. And we all know, folks, we talked a little bit, we scratched on suicide prevention, but we have all lost someone in this room from suicide, and we just aren't getting there. And I love the Your Life phone number and our school. So the city student city council kids, they came and lobbied with Bob and I and all of us for suicide prevention, putting the Our Life number on the back of all student IDs, and actually the code. What's that code called, you girls? Yes, the QR code. That you scan. It's because that's what the kids do. They scan everything. They don't talk. They just scan. And it had great support. Do you think we could get it passed? No. I mean, we don't know why. I'm trying next week on the standings bill, but it doesn't cost any money. It's right there for students if they need it. Several of the higher education facilities are doing that, but I don't know. I don't know. And now we've got another group coming in that wants to do another number. So we set in an HHS number, and they have some new numbers for people to call. But I'll tell you what, I had anxiety at the end of that meeting trying to figure out what number I was supposed to call. So I'm afraid they're going to screw up even our number. So anyway, that's enough of me.
So to summarize,
They need help and they need money.
yeah. And so accelerant, more challenges, no new resources, except collaboration.
Yes.
And we should hold that up
Yes.
on this table.
Yes.
Okay.
Yes.
Yeah. So here's a question for the experts of the panel. How can we help each other cope with anxiety and stress of the uncertainty from the pandemic? Take me through my breathing exercises.
The thing that came to mind the most is really saying no, having boundaries, making time for self-care, particularly for people who care and care and care, and just care a lot. There's a lot to be upset about right now. And I think in order for us to keep caring and keep helping and keep making changes, we've really, really got to focus on taking breaks, taking real care of the helpers, and also the helpers having some boundaries with themselves, using their vacation time, taking lunches, those sorts of things. So that's my input.
I love when people give that advice while they're serving on a panel that they're not paid for, that isn't part of their job during their lunch hour when many people would be taking vacation.
Look at Deanna's living it out.
Good advice.
Do as I say.
Well, I think that the pandemic, on the other hand, has given us an excuse to be more hopeful. But I think it starts with everybody in this room and everybody in the community. I happen to be mental health nurse practitioner, but I think the greatest source of help is in human relationships. And it does not require, for all of us, medication. It doesn't require the professionals if our families, our communities, our churches are more engaged and not afraid to reach out early on. there's all kinds of research forever that says for mental health, when you see the first glimmer of concern, that's the point of care that can turn that individual around and save them from needing a high level of mental health care. Not that we don't need that in our community, but when it starts with our children, when it starts with our veterans, our aging parents, whatever, if we can reach out and give the hand that says, you're loved, this community cares, and we're going to help each other get through it. Whether it's organizing your neighborhoods, there have been so many positive things in Waterloo with the neighborhood associations and the pride infusing back and reaching out and helping each other. I think that we've learned a lot from COVID, and one of them is that the human interaction, if you subtract it, we all go to shit quick. You've got to still have that eye to eye, the hand to hand, that warm touch. And just to say that taking breaks and stuff and helping each other, absolutely. But mobilizing your neighborhoods. When you bake something, share it with the elderly neighbor or the 2 school kids that have a single parent working and they're home for a few hours alone. If you have something to give from the heart, be open to it. Don't be afraid to offer it, because I think that's how we heal our community. And I'd like to give a shout out to the League of Women Voters that helped this, and the fact we have a representative. Don't tell me how many of you have reached out to your congressmen and women and told them what your ideas and plight are, but start doing it. They need our ideas for how to help us, as well as for us to tell them what's working well so that it doesn't go away. And unfunding is always going to be with us, or insufficient resources. So it's up to us to make sure that we don't squander the resources that we are given and that we make use of them. And that includes encouraging people to go into the healthcare field, especially into mental health care field. You know, we have kids that are either in high school or graduating and saying, have you thought about going into the mental health field? So I think there's a lot of reasons to be hopeful. And I will say, for our veterans who really are struggling, our VA assistants, we help pay utility, water, and electric bills. We help shelter for homeless vets. And right now, I think homelessness is a huge issue in our community, but I think the solution is to revitalize our neighborhoods, and Habitat for Humanity and some of our other projects are helping to do that, because getting a hotel room for a month isn't really a home. It might keep you alive when it's -10 in Waterloo, Iowa in December, but that's not quality of life. Helping to get people either into a multi-unit housing or to refurbish some of our older homes. Maybe 3 or 4 vets can live together in them, but look for those opportunities to support that. Thank you.
I heard Heidi mention the word hope, and I just want to add a little bit to that, because when we look at some of the most at-risk students, they're struggling so much with lack of hope, hopelessness. And one of the trainings we do on our campus is called VAR. It's a training that the Active Minds organization developed. It stands for Validate, Appreciate, and Refer. And if you think about that, I mean, it's a 1-hour training we try to do with students to help everyone be equipped with how to handle listening to someone who might not be hopeful that day. Validate them, appreciate them, and then refer them to a resource. We all can do that as people. You don't even really need the 60-minute training, although we prefer it. But, you know, it's a concept that if we all embraced and did with each other, I just think we could get so far. Because when someone's not having when they're hopeless, a smile, a simple gesture, and taking a little time to talk with them can change their, belief about there not being a reason to have hope. So I just wanted to talk about your hopeful.
I really like this covered it. You know, when we talk about connection and hope and building relationships and providing support in our community, it's that isolation that we really saw having such an impact on kids, adults across the board. And so the more we can build connections, the more we can reach out to our neighbors and do all these things that the rest of this panel has identified, the more we're going to normalize, validate what it is to struggle and to know that we don't have to struggle alone, and that we have others to be there for us.
Anything else? Well, I would just add one little thing, and that is we've all in this room gotten used to not going out. We've all gotten used to living on Zoom too, and it actually gets pretty easy, doesn't it? And so for folks who are online, or keep going out. Seek social space, seek shared learning, seek these social community experiences, because they will make you stronger. It's good for you. It's taking your vitamins. Anyway, we now have some time, and we actually have some time, which I'm thrilled by, to have some of your questions. Do you have any questions for the panel? Yes. So the question is, what is the location for the veteran services?
So it is in the brick building on Independence Avenue that the original St. Francis Hospital was in. It's been renovated. It's also where the Department of Health or the Department of Human Services is located. And so we used to just have 4 offices at the back of that. Now we have what used to be the child care center. So we have what would be the western wing on first floor of that. I can speak to that. I know exactly what you're talking about. That's the nursing home that's on Highway 63 right off Martin Road. And interestingly enough, yesterday at the Grout Museum, because every Wednesday we have coffee and camaraderie for any vets that want to come in, and we usually have a guest speaker. There are some state funds available to look at helping with homelessness, especially in the veteran population. When that project a couple years ago, maybe even 3 years ago, first came up, and that was taking a defunct nursing home that's all on one level, and it's kind of like a star. It's got a central, and then it's got corridors that come out. So we had an investor who wanted to turn that into a place for homeless veterans to come, maybe not to live permanently, but to help them during the time that they were homeless. When he went to borrow the money to renovate it, he sold it with the thought that physical therapy and some community resources that many veterans need would be co-located. And the bank at the time said, unless we have confirmation that those agencies are willing to co-locate, it's not a secure investment. And so it kind of went by the wayside. We talked about it again yesterday, that if we could maybe then find the gentleman, and I'm sorry, I don't remember his name, if we could apply for the state funds so that the funding piece wouldn't be the risk part, if he would still be interested in doing that. And that just came up yesterday at about 11:30 before we disbanded. So I think that homeless veterans, it's hard to know exactly how many we have, to be honest. We have quite a few that come into the office, so we do know that we have homeless veterans, but we also think we have more than we know about. Because after all, when you see homeless people on the streets of Waterloo and Blackhawk County and the other counties, it's not like they're wearing a sign that says, I am a veteran. And a lot of our homeless do suffer from mental health concerns. So it may be a bridge too far, but we're willing to try and ferret it out and see if we can still get that going again.
Thank you. Any other questions? This is a free counseling session with some of the foremost experts in our community. No, I don't. What would you like?
went from being able to see a therapist every 2 to 3 weeks to seeing a therapist once a month. And that's still what's happening. I had to fight to stay on my desk because the video link to the pill provider at BlackHawk-Bremer did not work. We messaged back and forth, but I thought it was my appointment. She decided that it was not. So I ran out of beds because the link to my provider did not work. And I had to fight. And the next time I saw that person, I got a lecture instead of care and compassion. Support groups dried up. Churches stopped meeting. We were left without the things we relied on, and it's not coming back. And I'm scared because I'm a person who go out and advocate for myself. But so many people cannot. And we're not seeing the services back. We're not seeing it. So what's going to happen to us? Are we society's throwaway?
I will just say, truly on behalf of BlackHawk-Bremer Mental Health Center, and that being the video experience, and we know we're pushing patients out when we are having a workforce shortage and openings and dealing with those things, but that's not the experience that we want. And I would be more than happy to speak with you further afterwards as well to get some more information about that, because I want to correct that. Yep. Good.
We had a meeting. The nurse was supposed to come. The nurse was a no-show. And all that the person did was talk about how she really didn't want to be there because she had a sick child.
Okay. Yep.
So the services that are supposed to be there for us are not.
Yep. Yep. If you would like, I would be more than happy to sit down with you afterwards and hear some more information about this, because I want to know if that's what's happening, because it's very important that that's not the experience. But we are, and kind of outside of that too, to talk about the shortage and how we're trying to elevate some groups and some supportive services. And we're trying to find those solutions, and we're running into those challenges as we're trying to partner with you and I to get graduates to stay in our area, to find people to fill these open vacancies so that we can provide care. So we aren't seeing patients once a month. So we're seeing them more rapidly. And those are solutions we're striving for. And that's not going to be a tomorrow solution, unfortunately. And we're all going to have to band together as a community, as partnering agencies to fill those gaps and meet those needs and grow our workforce considerably in Iowa and across the United States.
We need to say, though, thank you for your courage at sharing your experience and your concern. And on behalf of all of us who work in the mental health field, we are very sorry that happened, and we're working to fix it. But it takes the courage of people like you to share your experience so we know what to target. So thank you for having the courage to say what's been going on.
Yes, go ahead. Well, I'd like to thank both of you guys. So this is, we heard earlier when the panel was talking about the challenges they're facing. They're seeing unprecedented numbers. They're seeing unprecedented stressors and people being impacted more deeply than they've been impacted in the past. And this is the face. This is what that looks like in the field. They talk about being tired and having a hard time getting people leaving the field. That's also another face of this, but the people who left aren't here. And if you don't think it's a crisis, recognize that when they say they have 700 more patients this year, 700 more patients, this is what happens. Because you know what? Human beings are treating human beings, and the workload gets impossible. and things fall through the cracks. And it is not the intent of any professional to have that happen. People, of course not. Of course. Absolutely. And so as you're thinking about the mental health crisis, recognize that this is not a polite conversation of lovely people. This is something that's real and happening in the streets all the time. Sherry.
One of our objectives in having this panel today was, I think we need to talk and actually put this box.
Yeah, right here.
I think at one of the last legislative forums, you made some off-the-cuff remarks that really grabbed my attention. And you said, you know, we're all struggling. It's difficult. And I think sometimes, do you remember when you were a child and you still had that fantasy that your parents had it all together? And that being a grown-up meant it got it all together. The grown-ups need to say, you know what? It's been hard. It's been challenging. I'm worried about my sick child. I'm worried about my colleagues. Some of my friends, I am a retiree of Hawkeye Community College. And I know some of my friends just went through a lot of struggles. And I remember feeling a little guilty because I taught online for 15 years and liked it and thought, gee, maybe I should have stayed around a little longer. This wouldn't have been as challenging for me. But I think one of the things to think about right now is doctors, nurses, you talk about even truck drivers, the people working in the convenience stores, the frontline people, like in a battle, the people in the trenches. I want to apply all of you, but I want us all to have kind of a little epiphany and think about the people in our circle of friends who have been shouldering that stress, who have been part of that, filling the breach. And we have more work to do. And we need to act. If we have, sorry, can I just make a little bit of a partisan comment? If we have $1 billion, don't tell me we can't feed our children for lunch. Don't tell me that we can't hire more staff for some of these places. We need to think about how we value people and how that budget together to reflect those values. Okay, that's.
Thank you for your small partisan comment. Yes.
But it's just really evident that our senior population was impacted significantly during the COVID-19 pandemic. And what we're hearing from almost every volunteer line is that they recognize that they cannot sit only by themselves any longer. And so not only are they getting out, but they're getting out to see other people. And so they're taking this lead of their own and they're applying to community service. And so I want to offer that to those in the room have both are in need on the front space of someone who is certainly not mental health counselors. We don't have that skill set, but we have women and men with lived experience who are from this community and are facing many of the same struggles as adults in their team. So they can come out and they're part for that service. Of course, we're still looking
Thank you.
I love to hear about that because there's such benefit to the helper and the person being helped. And we're doing similar things at UNI with embedded peer mental health counselors. So sprinkling graduate assistants around campus so that there are stations for students to just stop by anonymously and speak with a peer who has some training and background in mental health. And similar to your seniors probably have some training as well, but I love to see programs like that where people are helping people and it's all volunteer and it's such a mutual benefit for both.
So we had one other question. We want to take a swing at that? We probably only have time for a couple answers. So
It's definitely real, racial and social trauma. It's similar in many ways to moral injury in how it expresses itself. But when you think about our immigrant population that's immigrating, not necessarily to have a better financial life, but to save their life and their family's life because of war and hate and injustice the world over, that brings with it layers and layers of pain and suffering. However, they tend to also be very resilient people because they were motivated with hope to believe that by coming here, their future could be better. And so again, reaching out where we can, whether it's patronizing the businesses that small businesses of those groups of people, and whether it's going to a restaurant and learning about Laotian food, Bosnian food, Ukrainian food, whatever, and taking the time to make that human to human connection. I'm thrilled to see a lot of people of color here today. I am thrilled to see the diversity of who is sitting here because we all represent, that's what America really is about, that diversity, and it's going to take all of us. But whenever you can, take the time and learn their story and learn their struggles so you can help them. And they don't have to be the latest wave of immigrants to still experience social injustice. I may look like a white woman, but I'm part Cherokee, and I grew up in a neighborhood where Native American culture was part of our family values and stuff. That was very different than a lot of kids I went to school with. But I grew up in a time where we embrace diversity more than be traumatized by it. Right now, with the polarization that's going on in the media, I don't care what your political leaning is. It has harmed us that instead of coming together, it has pushed us apart somewhat. And we are responsible for bringing it back together. And I think it's going to take local to do that, but to be sensitive. Have the courage to ask people who look different and are different from you to say, what's your experience? What do you need? And just to appreciate the different cultures and customs.
This is one of my really areas of passion. I worked at the YWCA and for Tri-County Child and Family before I went back to grad school and had the opportunity to work with a lot of diverse populations. I think more and more our eyes are opening to historical trauma, racial trauma, and that it's a lot more than just taking a 30-minute cultural competency training and calling it a day. Really addressing the racial differences, the cultural differences, and being open to having those hard conversations. We definitely need to really embrace the fact that, and especially treating mental health, it's our responsibility to know about these things and not put our clients in the position of teaching us, because that's on us. We're not supposed to be the ones getting educated necessarily. And so really searching out the opportunities to do that. And then of course, encouraging and providing more opportunities for people of color, for BIPOC people to pursue higher degrees and get into these fields, because boy, there is just such a power in seeing somebody who looks like you or having a conversation in your language. So this is something we need to keep working on.
All right. I want to make sure everyone can get to where they need to go first. These guys gave us their lunch hour. We probably should let them go back to work. And I know a lot of us all have things waiting for us, but I want to thank you all for coming out today. We talk about what you can do, and unfortunately, this isn't something where one bold stroke can change the world. This is actually going to be something of small, segmented little steps. Coming out today was a step. Stepping forward was a step today. So thank you for that. I'd like you to please join me in thanking our panelists. Finally, I will remind you that this is a League of Women Voters event. And one of the things we can take as a step is vote, and vote in an informed way. And so there are materials here. There's materials on the website. There are nonpartisan, issue-oriented sites where you can look up candidates, find out how they voted, and where they stand on issues that are important to you. Voting laws aren't getting easier. So if you're not sure, this is a great time to check your registration at the Secretary of State's office. Make sure your vote counts and make sure it's informed. So thank you so much for participating today, and we'll see you at the next one.
Thank you.